So, when it comes to sex differences in terms of who's more likely to develop Alzheimer's disease, it's women. Women are at about a twofold higher increased risk compared to men, and that's irrespective of their age. When it comes to reasons why women are at a higher risk of Alzheimer's disease, it's often been chalked up to women have a longer life expectancy, and that contributes to the difference. But longevity alone likely doesn't account for this disparity. And there are probably a lot of factors that are at play. One of the leading factors, of course, relates to hormones and hormonal shifts that occur during menopause that may contribute to this woman's disproportionate disease burden. But it's also important to recognize that while these hormonal shifts are happening during the perimenopausal period, there are other comorbidities that are also increasing. So, for example, cholesterol levels start to increase, which is an independent risk factor. Body composition changes. Specifically, women are more likely to accumulate fat in the midsection or visceral adipose tissue, which can be an independent risk factor. Sleep gets disrupted, mood changes happen. So, there's a lot of secondary factors that are related to hormones that also likely independently increase the risk. And then just in terms of pathological changes between men and women, it seems as though women have a faster disease progression when it comes to Alzheimer's disease. They seem to accumulate more tau pathology at the same level of amyloid compared to men. So we'll see equal levels of amyloid pathology between men and women, but women are accumulating more tau, and tau seems to be the biomarker that tracks more closely with Alzheimer's disease and cognitive decline. Another reason why women are disproportionately affected by Alzheimer's disease relates to the ApoE4 gene. So while we can see this gene present in both sexes equally, women who are ApoE4 carriers are at about a 4 times higher risk than men between the ages of 65 and 75. There have been studies that have even said that carrying one copy of ApoE4 in women is equal to carrying 2 copies of ApoE4 in men. I don't know that I necessarily believe that, because I think ApoE4 related risk really depends on so many other factors, including lifestyle factors, other medical comorbidities, other genetic factors. But that's what the statistics would show us. So I think the two areas really to hone in on for women are cardiovascular health. We know women are susceptible, and in some cases, when it comes to things like diabetes, may be more susceptible to the harmful effects of diabetes in terms of their Alzheimer's disease risk. So honing in on cholesterol, making sure you get that checked, especially in midlife. Insulin resistance, getting things like a hemoglobin A1C checked, a fasting glucose checked, a fasting insulin level checked, and triglycerides. Those can all tell us about your risk for insulin resistance. And then getting your blood pressure checked. We often go to the doctor and we may have borderline high blood pressure, and they say, you just came in and had white coat hypertension or white coat high blood pressure. You were nervous in the doctor's office. But I find that that often misses some of these earlier stages of high blood pressure. So if I were you, I would get your own blood pressure cuff and check your blood pressure at home when you're in your own comfortable environment. And then the other aspect of this is mental health. Depression seems to disproportionately impact women in terms of their risk for Alzheimer's disease. So, getting your mental health in check is a part of brain health. There's been so much stigma regarding mental health, and it's really time that we unify mental health and brain health because they do really go hand in hand. There's no shame in seeking therapy. There's no shame in having to start a pharmacological therapy if you need it. Whatever strategy works to help with mental health is really, really important. So Don't dismiss our mental health.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.